After launching in November 2022, it took ChatGPT just 2 months to become the fastest growing consumer app in history, gaining over 100 million users at an unprecedented rate. ChatGPT is perhaps the most prominent example, but certainly not the only one, of how artificial intelligence, or AI, is rapidly changing the world and the healthcare field along with it. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly with AHA Communications. These days, our ability to process and analyze enormous volumes of data in new and innovative ways is evolving at warp speed, and AI is at the forefront. What are the implications for healthcare? Where is all of this going? In this podcast, three experts from the American Hospital Association discuss the game-changing practical applications of ChatGPT and AI for healthcare data analytics and the potential pitfalls. Host Stephen Hughes is Director of Health IT Policy for the AHA. Brian Klein-Q and John Allison are both Associate Directors of Health Analytics Policy. Let's join Stephen, Brian, and John.
Let's step back for a second and talk about how we got here, right? That, with less than 15 months ago, the world changed when ChatGPT kind of just crashed through the room, right? And all of a sudden added AI to the zeitgeist and, catching a lot of us off guard. Now, as we know, AI has been in the healthcare space for decades, right? There's in diagnostics and in revenue cycle and in several areas, there's been tremendous advancement and practical application of it. But ChatGPT really accelerated and changed the way we think about it. It's changing the regulatory conversation around it. It's changing the way that every CEO and every board now is thinking about it. So when we step back for a second, talk about what you guys do in data and analytics. There is a Brian and a John that works in some form or another for most health systems, right? We call them different things. It might be a performance improvement team. It might be data and analytics team. It might be part of the strategy team. But one way or another, most health systems, whether they're doing it internally or thinking about it, through partnerships or consultants, are looking at how they use data, how they analyze data, and how do they either improve patient outcomes or make themselves more competitive, make themselves more efficient. So, Brian and John, let's talk a little bit about what you guys do. And then we're going to talk a little bit about how you guys were using AI and how it was valuable to you and how I think that'll be useful to our members who are listening.
So yeah, I'm John Allison. I think the most succinct way to describe what I do, at least the way that I approach my job, is my goal is to really tell compelling stories about hospitals to advocate well for them. Mm-hmm. And one of the tools in my tool bag to do that is data, right? There's a lot of it out there. Being able to understand it, being able to make sense of the anecdotes, for example, which is oftentimes really how you're learning, as you're hearing from members or other hospitals, being able to kind of convert that into something that's maybe more compelling is really important.
Right. I think you guys would agree that healthcare is unique among all sectors in terms of just the sheer volume of data, right, that you have. I mean, there's I talked in the beginning about finding use out of that data, but there's a lot of noise inside, right? Because it's just by the nature of what we do, by the nature of patient care, there's just a tremendous volume of data that's captured. And Brian, could you talk a little bit about the different languages around data? Like one of the challenges here is that it's like there's all this data and there's like several different languages that are being spoken in terms of how that data is understood and analyzed.
Yeah, absolutely. So the most common data analysis or data science languages are going to be your typical languages like Python or R. Mm-hmm. For historical institutionalized reasons, SAS still kind of has a large stranglehold over healthcare policy data. So for example, most Medicare claims, a lot of these files, they come in SAS formats. It's still kind of the lingua franca in our industry. That's kind of a challenge because there's not a lot of SAS programmers these days. And that's kind of a hard barrier to access for people to be able to interact with claims data. When you add in the fact that a lot of these data analysts, data scientists, they're not specifically gearing up to work in healthcare policy the way that John and I were, what that means is you're going to get a lot of great analysts and programmers who have no prior experience with SAS.
Now fast forward a little bit. So Brian, when you came in, tell a little about the story of like you've had a little bit of SaaS background, but
Oh, actually, it's back opposite.
oh, it's the other way around.
Opposite,
Sorry.
yeah. I
Yes.
have a lot of SaaS background.
Right.
I have not touched Python and R in maybe 5-6 years because I've been living in the SaaS world. So when I joined AHA in July 2023, I'm part of the new healthcare policy data team, and our manager, I think in week 1 or week 2, he sits me down and says, "Hey, Brian, there's this really complex data project that John is handling right now. Can you take a look at all the complex, great code that John's been writing and try to contribute to it?" And if this was July 2022, before ChatGPT came out, I would have had to tell Aaron, "So, Python's on my resume." But the thing about that is, I'm still going to need 3 weeks to make sense of what John's been writing for the
And
past
maybe
6
a
months.
class.
Yeah, exactly.
Yeah, and maybe do a lot of Googling and
John's going to have to sit me down and go like line by line.
Yeah. Right.
But because it's July 2023 and not 2022, ChatGPT is out, and I can tell Aaron, like, yeah, no problem. So John hands me off the code base that he's been working on. I feed literally everything that's not sensitive into ChatGPT.
Right.
And because I have experience with programming languages, I knew Python in the past, I'm able to pick it up pretty easily with the help of ChatGPT explaining to me what these specific lines do, what the overall structure is, and all of that. So literally from day one, I'm able to plug in and contribute to what John's been handling for, I don't know, the past 6 months.
Yeah, I mean, I would say not only contribute to it, but just like make it better really quickly. Like I remember some of the code you were sending to me and some of as we were working on it, I was like, oh wow, this is a really good idea. Like I hadn't thought to do it this way. And and I think probably the thing to like underscore there is for data analysts, ChatGPT is really quickly becoming a must-have in your quiver. It might be the quiver. It is so important for data analysts in terms of like the tool bag you reach into when you're doing your job.
Oh, absolutely. Healthcare policy, you are working with really a diverse array of languages.
Yeah.
But you kind of develop an expertise in one, and you kind of just have to make do with whatever knowledge you can get to parse through all the other projects. For example, claims are going to be mostly in SAS files. If you do data analysis or processing, a lot of people like to use Python for that. But if you look at the claim pricers for like how CMS actually prices claims, all those source files are in Java. So you really have, if you can have a tool like ChatGPT that can help you process these very different languages easily,
Right.
that's an incredible boost to productivity.
And there's a couple of important points here, and one, to extend the metaphor of languages out. Effectively you have a Rosetta Stone, right? That's understanding these languages, because you just we have 2 different languages we started with. So if we're extending the metaphor out, we've got Mandarin and English. Now, if you're adding Java, on top, you're adding French, right? We keep adding more and more languages, more and more expertise, more and more time, and someone who's not familiar with something. So ChatGPT effectively was acting as that kind of universal translator.
What ChatGPT does is it says, okay, so maybe you weren't as strong at learning programming languages or Java or whatever it is. ChatGPT is going to help you get there in a way that I would have said would have taken you. You talked about weeks to get caught up. That's because you had some experience with some of these languages before. For someone who doesn't, you're talking years, right? And that's for most of the data analysts that would be listening to this, or that are, if you're a health system C-suite, that would be working for you. 15 years ago, 10 years ago, even 5 years ago, it probably took them years and years and years of not only learning the language, but getting really comfortable in it, learning how to use it to become the data analysts that they are. That takes years.
So there's this concept of upskilling, right? And I know this is a concern with CEOs everywhere in health systems now that are thinking about, applications and investment in AI. And it's an important piece because a lot of, again, let's go back to 2022. And it's, the AI is coming for our jobs. There's the crisis, right? We've now gone to this idea of it's not taking jobs, it's making individuals better at their jobs, right? It's, like in our case, like in the AHA's case, rather than having to hire 2 more Brians or a John and 2 more Brians, right? I'm now able to take Brian and John and upskill them to a point where I'm getting much more productivity out of 2 individuals by upskilling.
I think with something like ChatGPT, that years of like building up this experience and skill set to be able to tackle a problem has really been ameliorated. And to the extent that if I'm an analyst and I'm working at the HA, which I am, and there's a big question that we have, something we want to answer on a topic that maybe not all people have talked about yet. And there's some data out there, but it's just huge. We don't understand it. Instead of me thinking, well, that's a waste of my time. I shouldn't be actually trying to answer that question.
Right.
Instead, I'm thinking, okay, with ChatGPT, I feel reasonably confident that I can take something that's currently incredibly difficult to understand, and I don't have a ton of background in, and I can still ask this big question from the data and reasonably expect to get an answer and not take years to do it. That's just hard to underscore how game-changing that is, at least from my perspective. Whereas before, I would have asked a really good question about my data, like what is driving this trend that we're seeing in healthcare and hospital utilization and things like that. And while the data sets might have been available to me, a lot of them aren't, by the way, but the ones that are publicly available, I might have just shied away from asking a question. It's like, well, I don't have the next 10 weeks to devote to this. And nowadays, I would say that's a week at most.
But then the other part, which I think again would resonate with most health systems, is this idea of like, they've got a lot of data. That's not the problem. They've captured all kinds of data. It's just in all these different places. You have a lot that's in the EHR. You have a lot that may have predated the EHR, right? That you've been hanging on to for years because for regulatory reasons. But are you actually making use out of it to create, again, better outcomes, other business opportunities? Who knows? And then sometimes, again, there are disparate sources, right? What have if you acquired another health system that has a different EHR, you acquired a practice or partnering with a practice, and they've got, again, it's a different EHR, or God forbid, paper. How am I bringing this all in, or what tools am I bringing in? And in most cases, those answers are going to be, I have a very hard time doing that internally, right? I'm going to have to, I'm going to have to either move all of this to some cloud-based service, which cost, security risks associated with it, time, when am I going to get value back out of this, as opposed to, hey, this is my data, and now I can take a very narrow approach to my data and solve problems and get value out of my data with my staff inside a health system, right? Which is going to cut the security risk problem, the cost concerns, do I bring in consultants? Do I, all these other issues? I can actually start solving these problems internally because I have tools like, GPT, right?
Probably something to underscore is if you're looking for an application of AI and you're like, well, I'm not a huge health system. I don't have these resources to spend on these more clinically based AI applications, or maybe even some sort of, chatbot things that maybe are more business oriented, consumer facing potentially. A really like an area of a lot of low hanging fruit for the use and practical application of AI tools like ChatGPT is going to be data analysis, frankly. And some people might find that boring. Other people might find that exciting. But when you I think that's important to contextualize. It's something that ChatGPT does pretty darn well compared to a lot of the other things that it does. It's going to help you think through data problems comparatively pretty well. And I would say if you're looking for a place to kind of grow your hospital, your health system, whatever it is that the business you're working in, it'd be to be thinking about how to apply these tools to data problems. If your analytics department, your data analysis teams, are the people that are helping with decision support, business intelligence, whatever it is, that's the group out of anyone in an organization that I would think would be leading the charge.
Right.
In a very, I hate to use this word because we're in DC, but in a very grassroots way, right? Like you're not being told to do it. It's very organic. It's
right.
Like, this is making me better at my job.
And yes, it starts in data, but I think that, your insight there, John, is good. And I think it's applicable really to even outside of data analytics, right? The idea that the use case came out organically by need.
Yes.
So and I think if there's a lesson there and there's marching orders to then take out, really any level of management in a health system that may be listening to this, all the way up to senior executives and board members, is worry less about trying to shoehorn a solution into the organization. It's go down to the practitioners, right? Go to your people on the front lines, go to your experts and ask them about how they could use it, right? And that's where I think you're going to get the most effective, examples and the most effective tools are gonna emerge from that.
It's true that this is an incredible tool and you can solve so many issues and you increases productivity so much in the hands of somebody who is competent and somebody who is
In the hands of someone who is competent.
Correct.
Right. You have to have a baseline competent person to start with that you're upskilling, as opposed to it's what you're not doing with ChatGPT or really with AI in general. And this is, you could extend this metaphor out to the kind of the absurd level of, you're not going to turn somebody who didn't go to medical school into a radiologist because they're using an AI tool to look at diagnostic images, right?
Mhm.
You start with a radiologist, add the AI onto that, and they get much more productive and much more effective at, picking up abnormalities in the mammogram. Just like you take someone who's got good, or at least a basis with understanding data languages and good analytical skills,
Mhm.
add AI, they're going to be much better at doing decision support.
Exactly. And the
Yeah.
criteria for evaluating who's good at analysis has changed with AI.
And I'm glad you brought this up too. So we're not just sound like that we're a bunch of just GPT and AI cheerleaders, right? There's always a downside of the technology. So let's talk a little bit about the quality measures. So how do we do that with ChatGPT and data analytics? How do you apply that safety criteria? What are the tests, or what are the outcomes?
Yeah, that's a good question. And you hit on a really, really crucial thing, because that's something, especially in fields like healthcare systems or health policy in general,
Mhm.
there's not a lot of that kind of thinking. A lot of people, a lot of organizations, a lot of agencies are not concerned with, how do we know that these numbers are right? How do we know that these algorithms are correct? And we see how many mistakes CMS makes all the time. It's not limited to CMS. All agencies and companies do that.
Mhm.
But one thing that I find shocking, and that we need now more than ever, is there's no emphasis in the interview process for a lot of these places on, how do you sense check your numbers in a project? It's all, what are the results of the projects? Give me examples of projects you've done. And it's never, how did you know that your project was correct? Explain to me your benchmark process. Explain to me how you were able to contextualize the numbers you got. The answers to those questions are much more indicative of how meticulous someone is and how analytical someone is, than them being able to list 5 languages on their resume and say, okay, I created this algorithm and it gave me this many charts, and here you go.
So would you be saying, in a way, that the way to actually make sure that you're using GPT safely and effectively is to actually double down on your people hiring process,
Or instill a culture. Instill a culture that is much more
which again, very human centric.
process. Yeah,
Right.
yeah, right.
Interesting. So
Process-based.
to ensure quality, it's make sure that you're being careful about your hiring practices, right? And instilling a culture of quality and high levels of ethics in those who are using the applications.
The number one thing you can do if you've already hired a person to improve the culture of checking the quality is just literally ask, how do you contextualize these numbers with other entities' numbers? Can you think outside of GPT? Are you
Right.
contextualizing everything you're doing?
Oh, I love that. So actually ultimately control quality in GPT or tools like GPT, think outside of GPT. And in the end, AI is a piece of technology. Really what we should be thinking about in health systems is a thoughtful application of technology. This is just one more thoughtful application of technology. Overall, I think it's connecting back to what Brian was saying, which again connects us back to the human-centered nature of this. That ultimately the quality control check for use of AI in data analytics and decision support is, do you have a culture of quality, right? Do you have a culture of peer checking around what you're doing? Ultimately, to get the most out of AI across the system, across healthcare, is encourage a culture of innovation and creativity, right? Know the tools are out there. Encourage people not to be afraid of it. Go look at it and suggest things. You'd be amazed what you might find. Well, guys, I think that's all the time we have. I really appreciate it. John, Brian, thanks so much.
Yeah, thank you.
Pleasure to be here.